In tonight's Your Health segment, Dr. Syed Hasan, Associate Professor of Orthopaedics at the University of Maryland School of Medicine and surgeon at the University of Maryland Rehabilitation and Orthopaedic Institute. Doctor, thank you for being with us.
Thank you for having me.
Just out of surgery this evening, working on shoulders. That's your specialty?
Exactly. Yeah, I just was operating on individuals with various shoulder injuries.
What's the typical injury that sends somebody to surgery for a shoulder problem?
Well, it really is we see two different peaks of injuries. So in the younger individual, more active population, we see a high incidence of shoulder dislocations, shoulder separations. And those are very commonly seen, especially in the time when we're doing contact sports. Football season is going on, hockey, those kind of sports, we see a lot of that. Biking, we see a lot of shoulder dislocations and clavicle fractures.
Because you have a fall and land in a certain way. Is there a certain type of hit or landing that tends to pop out the shoulder?
Well, interestingly enough, for example, cyclists, when they fall, they tend to go over the top of their handlebars and land on the point of their shoulder and sustain a clavicle fracture or fracture the collarbone or separation. That's a classic injury. Basketball players, when they're going up for a rebound and their arm sort of goes up in this position to get a rebound, that's when they can potentially dislocate. So those are some of the classic injuries we see.
And then the second set of cases you see, I imagine, is more age-related problems?
Right, exactly. So really what we see is that rotator cuff problems are more commonly seen really over the age of 40, and certainly over the age of, when you get in the 50s and 60s. And what we're seeing nowadays is that, our population, of course, the first baby boomers became senior citizens 2 years ago. And so there's, the growth is exponential in terms of the baby boomers. But, the senior citizens, if you want to call them that, although nowadays that's not really probably an appropriate term, they're so active. They're out there, they're not sitting at home, they're very active. And so they tend to get injuries as well. And their injuries tend to be more in the rotator cuff, because the rotator cuff does have a normal aging process where it gets degenerative tears and is then more susceptible to bigger tears later.
You brought a shoulder display with you. What is meant by the rotator cuff?
Sure. So
you hear about it with pitchers.
Right, exactly. Well, that's true. That's true. That's another time you can injure it. So the shoulder is a very unique joint. So as opposed to most joints, which are a deep ball and socket, the shoulder is really a shallow socket and the ball. So it's almost, what I tell my patients, it's almost like a ball and a saucer. And so the shoulder joint, because of that, is inherently unstable. And what keeps it stable is the rotator cuff. And the rotator cuff are the muscles that come from the scapula bone here, and this is representation, this white here is representation of the muscle, and it ends in this tendinous portion on the ball. And that keeps the ball centered in the socket and allows the big muscles then to rotate the arm freely and have normal function.
So the fact that the joint is less encapsulated by bone is what allows for the tremendous range of motion that we have.
Absolutely.
But
Absolutely.
Also allows for injury.
Right. So that's why the shoulder joint is perhaps more susceptible to wear and tear injuries, than perhaps the other joints around the body. The
other piece you have with you appears to be an artificial joint.
Right. So what we're seeing also is that we've seen a very interesting trend in shoulder, in our treatment of shoulder problems. And one is that I think for the longest time people were content. I don't know if that's the right word, but were tended to live with pretty severe shoulder pain. And it's probably for a couple of reasons. One is that if people have severe hip and knee pain, for example, they can't walk. And so that's debilitating. But if they have severe shoulder pain, they say, well, I got another shoulder, I got another arm. I can use that arm, and this is okay, I can sort of make it through. And so people would put stuff off, and shoulder arthritis, the replacement surgery came a little bit later than hip and knee replacement. Now it's really a state-of-the-art operation in which we can restore normal function, take away pain, and get people back to a high quality of life. And this is just an example of a shoulder replacement. And basically what we do here is, and I'll separate these out so you can see it, but here's the scapula, or the shoulder blade, if you will, and we resurface that with plastic. And then the ball portion of the joint, which is normally arthritic, we resurface that with a metal. So now you have a nice smooth articulation of metal on plastic, which importantly eliminates pain and then restores function.
Let's take a phone call. This is Ruth in Baltimore County. Ruth, thank you for calling. Go ahead.
Hi, doctor. My son just had labrum surgery on his shoulder, and I wondered how effective that was and if it lasts for his life or does it have to be repeated.
Thanks for the call.
Thank you. Yes, labrum surgery tends to be very effective. It's usually done in a situation of an injury or a dislocation. We do it all arthroscopic these days through mini keyhole incisions. And typically, yes, it's not a surgery that typically needs to be repeated. Usually it's of course you can always re-injure your shoulder, but typically the labrum heals well in the younger individual and it gives a long-term result.
I remember hearing once that the artificial shoulder joint has a longer lifespan than a similar replacement in the hip for the reason that you're not walking on it. Is that the case?
Yeah, I think that's a very important point, right? So that the shoulder is not a weight-bearing joint, and for that reason, there's not as much stress across it. And so what we've seen is that the lifespan of the artificial joints are the shoulder artificial joints are well up into the 90th percentile, even after 20 years.
Wow. Let's talk to John in Harford County. John, thanks for calling. Go ahead.
Hi, Doc. I'm asking what's the expense cost for the operation for a rotator cuff?
Repeat that if you would.
Yeah, what's the cost to have a rotator cuff repaired?
Okay, thanks for the call, John.
So the cost of the rotator cuff repair? It's a good question, and I'm not sure I can give you an exact answer.
but it's a larger debate, right?
Yeah, right. I will say this: for the most part, rotator cuff repairs are covered by insurance. This is a recognized injury. It's one that is treated routinely, and insurance companies cover it.
What can be done short of surgery in terms of rehab, injection, medication? What's in the arsenal?
Sure. So, shoulder injuries are exceedingly common. So our latest data suggests that there are 7.5 million patient visits per year for shoulder pain in this country.
Wow.
And of those, about 4 million are for rotator cuff problems. And so, of course, not all of those 4 million people or those larger 7.5 million people need surgery. And this can be treated very effectively with injections. Cortisone injections I use a lot in my practice. And it's usually a one-time injection. It's not, we don't do repeated injections. Anti-inflammatories have some role. I think in chronic situations, I'm not as fond of them because of the side effects. And then physical therapy is very helpful too.
You typically run through a couple of those before surgery?
Yeah, so it depends. I think if somebody comes in with a dislocation, they got a massive cuff tear, then that has to be fixed. But sure, somebody comes in with sort of chronic pain and been for 3-4 months, yes, absolutely, injection, physical therapy, see how they do.
Very good. Dr. Syed Hasan of the University of Maryland School of Medicine and the University of Maryland Rehabilitation and Orthopaedic Institute. Sir, thank you for being with us.
Thank you for having me.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.